everyone, I'm Genalyn Guevara, student of Filipino Institute, CNA Batch 3. My disease topic for today is abbreviated as DM, which means diabetes mellitus. Let us begin. Diabetes is a group of metabolic disorders characterized by abnormal metabolism, which result most notably in hyperglycemia 140 and above mgdl sugar level due to defects in insulin secretion, insulin action, or both. On the other aspect, hypoglycemia, 70 and below mgdl sugar level, is also prevalent to diabetics. Diabetes is a chronic disease and it has no cure. So what do is just control the symptoms of this disease. And with that, we will go to the different types of diabetes. There are few different types of diabetes. Type 1 diabetes is an autoimmune disease. The immune system attacks and destroys cells into a pancreas where insulin is made. It's unclear what causes this attack. About 10% of people with diabetes have this type. Type 2 diabetes occurs when your body becomes resistant to insulin and sugar builds up in your blood. Prediabetes occurs when your blood sugar is higher than normal but is not high enough for a diagnosis of type 2 diabetes. Gestational diabetes is high blood sugar during pregnancy. Insulin blocking hormones produced by the placenta cause this type of diabetes. A rare condition called diabetes insipidus is not related to diabetes mellitus, although it has similar name. It's a different condition in which your kidneys remove too much fluid from your body. General symptoms. The general symptoms of diabetes include increased hunger, increased tears, weight loss, frequent urination, blurry vision, extreme fatigue, sores that don't heal. Symptoms in men. In addition to the general symptoms of diabetes, men with diabetes may have a decreased sex drive, erectile dysfunction, and poor muscle strength. Symptoms in women. Women with the diabetes can also have symptoms such as urinary tract infection, yeast infection, and dry, itchy skin. Type 1 diabetes. Symptoms of type 1 diabetes can include extreme hunger, increased tears, unintentional weight loss, frequent urination, blurry vision, tiredness. It may also result in mood changes. Treatment of diabetes. Doctors treat diabetes with a few different medications. Some of these drugs are taken by mouth while others are available as injection. Type 1 diabetes. Insulin is the main treatment for type 1 diabetes. It replaces the hormone your body isn't able to produce. Type 2 diabetes. Diet and exercise can help some people manage type 2 diabetes. If lifestyle changes aren't enough to lower your blood sugar, you need to take medications. Treatment. Educate about home glucose monitoring, review factors in glucose instability, encourage client to read labels, discuss how clients' anti-diabetic medication works, check the viability of insulin, review type of insulin use. Blood glucose testing is used for persons with diabetes. Rules for blood glucose testing. Follow the manufacturer's instructions for the glucometer and disinfectant. Know how to use the equipment. Request any necessary training. Make sure the glucometer was tested for accuracy. Check the testing log. Enter a code or user ID if required by the glucometer. This is provided by the agency. Do not share your user ID with others. Make sure that you have correct reagent strips for the glucometer you are using. Compare the code number on the strip with the code number on the glucometer. The code number should be the same. Scan the barcode on the bottle of reagent strips if needed. Check the color of the reagent strips. Do not use discolored strips. Check the expiration dates. And the reagent strips, do not use them if the date has passed. Report the result to the nurse at once. Record the result following agency's policy. Supplies needed: sterile lancet, antiseptic wipes, gloves, go squares, glucometer, reagent strip. Use the correct ones of the glucometer. Check the expiration date. Disinfect. That's all about my topic. I hope you learned something. Thank you for watching. I'm Genalyn Guevara. God bless. Thank you.